Hair loss, common causes and treatment. Hi everyone, I'm Dr. Nana Boachi, board-certified dermatologist, lifestyle dermatologist, and I'm going to talk to you specifically about non-scarring alopecias. What's alopecia? Alopecia is a common condition that we see in men and women. If you notice any hair loss, see your dermatologist because early intervention is key. Does it? So alopecia just means hair loss, and to a dermatologist it actually doesn't really mean much because there are two types of hair loss. There can be a non-scarring alopecia or hair loss and a scarring alopecia or hair loss. Check out part 2 to learn more about scarring alopecias. In my practice, I see a lot of patients with non-scarring alopecias. So if you are experiencing any kind of hair loss, I'm going to walk you through what I would do for you. The first thing that we do is take a thorough history. So I ask you about your medications, your lifestyle, and even how you treat your hair. You'll be surprised that many individuals, especially those who are melanin rich, whenever they're experiencing hair loss, they tend not to wash their hair. Or they may have a protective hairstyle and they think that that protective hairstyle is actually going to help them with their hair. Protective hairstyles. Is it really protective? Sometimes it's just way too tight and then you develop traction alopecia. But my beef is that y'all are not washing your hair. Would you not shower for 4 weeks? I mean, you have to wash your hair weekly in order for your hair to stay clean and in order for your hair to grow. So please, when you're wearing these protective hairstyles, make sure you wash your hair at least weekly, not every month or 2 months. Gross. So there's a lot of things that we do by taking a thorough history. After the thorough history, we do a physical exam. We're not just examining your hair, but we're also examining your scalp. And then we're also looking at other parts of your body, such as maybe your eyebrows and looking at your arm hairs, just to see if there might be a connection between what's on the hair and what's on your body. So now, after I've taken a thorough history and I've done a physical exam, sometimes we go ahead and look at labs. So some labs that we can look at are maybe vitamin D levels, maybe look at your iron levels, your thyroid levels, to see if there's a possible connection. So what's the differential diagnosis? So let's go through a list of differentials for non-scarring alopecias. The first one, which actually hits home to me, is alopecia areata. I actually experienced this condition when I was in my residency program of dermatology, which was many years ago in 2004. So what is alopecia areata? Alopecia areata is an autoimmune condition that presents with sometimes these coin-shaped lesions that can occur on your scalp, it can occur in your eyebrows, your beard area, and it actually presents in a spectrum because there are some people who get those coin-shaped lesions, or some people don't have hair all over their body. So I presented during my first year of dermatology because I was extremely stressed. That's possibly one of the causes, but we really don't know the causes of alopecia areata. And I had these coin-shaped lesions on my scalp. I had about 2 of them. And the way that we go ahead and treat them is sometimes you could treat them with intralesional injections or steroid injections. Sometimes you could use a topical steroid depending on the age of the individual. There are some irritants that you could apply to the scalp, and now there is an oral medication that you can take for alopecia areata. So we've advanced in this area tremendously over the past few years. Another common non-scarring alopecia that we tend to see is something called anagen effluvium. So these are individuals who have taken a chemotherapeutic agent, and as a result of that, their hairs have fallen out. But what's beautiful is that once they stop the chemotherapeutic agent, their hairs do come back in. Sometimes the texture of the hair changes, but luckily, since it is a non-scarring alopecia, their hairs do come back. Another common alopecia that I tend to see in my office is androgenetic alopecia, or female pattern hair loss, or male pattern hair loss. This is a very interesting condition because the spectrum or the presentation of this condition is very vast. Sometimes in males, we tend to see that they're bald up here and they have this receding hairline. In females, the front of their hairline is usually spared from this condition, and then you start to notice that they have thinning right over here and then right over here. earlier. So basically, as you start to go more interior into their hair, it starts to thin. And this is really devastating. But luckily, there are some really good treatments that you can use, and that can range from minoxidil, sometimes spironolactone, PRP. There's a laser that can be used. So there are some treatments that can help you hold on to those hair follicles. Another non-scarring condition that we tend to see in kids primarily is something called tinea capitis. Hi Derm Babes, it's Dr. Nana Bawachi, and today I'm going to talk to you a little bit about a fungal infection occurring on the scalp of this little girl. So this fungal infection is very tender, it's boggy, she's beginning to lose a lot of hair here, and it's quite large. When we were examining her neck, notice how she has this large lymph node here, which is extremely tender. So when she came back 2 months later after being on antifungals, look at this widespread infection. But what I loved about this visit is that she is growing hair, but what I love more about it is that Mom and I were talking about how to style her hair. We were talking about putting it up, down, and that's what's fun about these visits. It's not just about dermatology. So tinea capitis is where you get fungal infection of your scalp. We tend to see this in all skin tones and all ages, but I primarily see it in kids because they're coming in contact with each other. But luckily, once you make that diagnosis and you treat it with the proper oral medications, their hair. Trichotillomania is a condition where individuals present to my practice where they have patches of alopecia that are irregularly shaped, and it's due to an impulse control disorder. In terms of treatment, we try to do an integrative approach where we involve a therapist or a psychiatrist in order to modify that behavior in order for the hairs to generate. Lastly, let's discuss trichorexis nodosa. This is a condition that can be either genetic or acquired, and it's due to hair breakage. So genetically, your hair could just automatically break. But if it's acquired, it could be due to some form of trauma like heat, chemicals, or maybe some form of a pull. So as long as you stop that offending agent, hopefully, if it's acquired, the hairs could grow back. But remember, if it's genetic, unfortunately, it's just going to continue to break. So all in all, with non-scarring alopecias, as long as you see your provider early on, your hairs will generate back. In my story, remember when I told you I had alopecia areata, I did a course of steroid injections over the course of 3 months, and I haven't had alopecia areata again. So as you can see, when it comes to hair loss, there are a myriad of different differentials when we're thinking about a non-scarring alopecia. And it's so imperative that if you're noticing any type of hair loss, you see a provider immediately. Do not wait years to come in, because then it's harder for us to possibly get your hair to grow back. If you find this information valuable, please like, comment, and subscribe, and I'll be here for another hour to address any of your questions regarding non-scarring alopecias.